Our speaker today is Dayse Sena. Many of you, but not all of you, will remember her as a wonderful member of our club for, I think it was about 4 or 5 years. Dayse is a doctor. She has children who were at school here in Boston and evidently are still around that she has come to visit. And she is working hard in taking care of people in Brazil. And I believe she's going to talk to us about the state of COVID in Brazil and what they're doing. So with that introduction, I give you Dayse Sena.
Well, thank you so much, everyone, for inviting me here today. And please excuse me my English because I have not been speaking for about a year now because of all the COVID in the situation in Brazil. So if you don't understand anything, ask Susan. She's quite knowledgeable when I speak. Well, for the ones that don't know me, I'm originally, yes, from Brazil, and my medical training has been in ophthalmology. And my research training has been in genetic of glaucoma at the Massachusetts Eye and Ear Infirmary here in Boston. I work in a teaching hospital as preceptor of ophthalmology, resident and medical students in one of the biggest hospitals in the northeast of Brazil. It's a small city called Recife. And surprise, surprise, has been over 30 years now. So I'm kind of getting ready to retire. And then finally came COVID-19. And it's a funny story, but I'll tell you later. And I'm very proud to say that I have two grown-up daughters, Brenna and Bianca. I think a lot of people already know them because they saw them growing up here in Brookline. And yes, one is a lawyer now from Northeastern Law School, and the other one did her master in global public health at Columbia. And she is now doing a work for a company here in Boston that developed tests for COVID-19. So I'm very proud of her. And the other thing that I would like to say that I don't know if everybody knows about it, but I know the one that knows me better, I love my job. And I love to help people. And I hope to be able to work with people and help them for the rest of my life in one way or another. You know, I hope that I will continue doing that. So let's talk about what Susan asked me to do. I did this little introduction because Susan also asked me to do the introduction. So she's okay. She didn't need it to do it. She said, just do it yourself. And that was good. Okay. As you know, the COVID-19 started in China. I just don't know if you knew that it started a case. The first case that was published was an ophthalmologist, an eye doctor, like myself. And I will tell you later why the eyes doctor, they get more COVID than the other physicians. And then that expand to Europe, as everybody knows. And it's a little behind came America. And in Brazil, the scenario was that it started in the upper class population, probably because people were able to fly to countries like to Europe and bring to Brazil and forth and back. So that's how the first cases started in Brazil. And this wave of cases contamination happening in people that had initially, they had like this private health care insurance that in Brazil, you can count only for 20% of the population of Brazil. So we are talking only 20% of people has private health insurance, and that had the resources to treat COVID-19 also at home or in private hospital. And we believe that the disease has not completely spread through the poor population yet. And when we're talking about the low income population, we're talking about, the 80% of the population in Brazil that does not have private health insurance. They used to have, they used the public health system insurance, that's free for all, which does not have as many medical equipment as the private health insurance. So right now, everyone fears that we're going to have more cases in the lower class, the public poor population. And we feel that the increase in criminal cases because of the lots of poor people, they lost their jobs right now, and now they have to bring food to the table one way or another. And this criminal case has been increased over time. We don't have now a precise number for the data about the number of cases. And why we don't have that? Because we don't have the capacity of testing everyone. That should be, the what everybody should be doing. Everyone should be tested. But we have very much difficult to test people because many reasons, as I said, but also the main reason, the financial resources has been allocated to build more campaign hospitals. They are for low class population, so we're more like investing into the campaign hospital instead of buying tests. um, at this time, there are a lot of campaign hospitals being built in soccer stadiums, in parking lot of shopping center. So there's a lot of things trying to get the people into the hospitals necessary, and they are building this capacity. That's a good thing, and that's our initiatives supported by the local government and of each state and the Ministry of Health of Brazil as well. And that's a good thing. And then, as I mentioned before, we don't have the ability to test everyone as we should. And maybe in the next month, we'll be able to test all the health workers. They are the most important people at this moment to be tested because they are treating people at the hospital. So hopefully in the next few months, we get more testing in. And so we'll be able to track that down. Also, at this point, we hope to have access to more important things like the PPEs, that are the personal protective equipment that all the medical staff should have, like the face shield, goggles, and the N95 mask. And of course, more testing for COVID to estimate the number of infected per day with more precision, especially the ones that are working with the patients. This is quite difficult to manage, as you can imagine. That have the If people has the COVID-19 disease and you have more, other diseases, it's even more difficult to treat these patients. So we have patients that can wait to get treatment. So we have delayed their treatment. So there have been a lot of backlog patients for that reason. And for example, my patients that have glaucoma, now they're taking their medication. When I'm just postponing their annual visit for next year, and we're taking more, the surgical and urgent care patients at this time. I believe that's the same thing in here. I'm sure Phil Sandler can talk more about that later too. But I talked to a few friends from SINE, and they said that they are trying to get the same approach, bringing in who needs most, and then next year, the rest of it. And I'm trying also to start a teleconference. It's like a teleconsultation for ophthalmology and glaucoma patients, orientations. And if they need a specialized exam, then we schedule a visit at the hospital for them. That's the next step for us. At the hospital in Pernambuco, that's the federal university where I work most of the time with low income patients, in which has reduced number of physicians to see patients because as we are um, teaching, we are older than the regular teaching people that are in the hospital. We have very low staff at this moment. And 2 months ago, the Brazil passed 100,000 deaths due to COVID-19. So more than 1 million COVID-19 cases now in Brazil. In terms of, I always like to talk a little bit about clinical research because that's what we really need to be doing. But in Brazil, it's very small. And I have no idea when we're going to start being able to do, research on that field, because right now everything is on hold in terms of ophthalmology clinical research. Um, and I feel very sorry about that. In terms of, I think another thing that I like to point out that I have seen a lot of the patients, also physicians, is the terms of stress. A lot of people at this time is being difficult to manage the stress, and even I have to deal with my own anxiety to treat patients, and I have to understand the patient's anxieties as well. So sometimes, if a patient has, let's say, asthma or diabetes or cancer, and they need surgery, it's very difficult because we need to manage the stress and make it more cost effective and try to do the best for both sides. So the stress management now has also been a big problem at this whole situation. I talked to a lot of people about how they manage this situation. And some friend tells me that they are doing more exercise. Like myself, I do like a lot, I like to bike around, and I do more things to distract from the news at the moment. So I like to listen to music, things like that, read books, instead of watching the news, being more stressed out. And again, Phil can talk about more this stuff because he's the specialist in this field. Right now, everything seems to be about the political point of view in what it is against the president or in pro of the president. And I believe this is because of the election time of the year in Brazil also. So I try not to talk too much about politics because it's not really my field of expertise. So I just work with the patients. So um, I'd like more here just to talk about the medical information that was the topic of this day. And so there is no magic, solution for that. I think that things will pass in the next couple of months ahead, and we will learn how to deal with that. And we will, being more flexible in terms of, trying to understand others as well, because every case it's a different case situation. So hopefully we'll feel more comfortable in Brazil also, to treat patients and as well as try to manage, like this situation as right now. As doctors, we work in hospital clinics, and the patients coming into my office every day. But once they are in my office, they are under my care. So now we need hours to work as a team. And we have been working together as a hospital instead of one-on-one just with the patient. So now we are always helping each other in the medical care in Brazil. So I'm not sure if I forgot anything. I did talk about the stress and about the medication. So I'm open to questions and from anyone.
Arnie.
Yes.
Thank you for a wonderful synopsis of your work. When in Brazil, when they register COVID deaths, say a person dies of a heart attack and has COVID, are they registered as a heart attack, COVID, or both?
Well, that's a good question. I think what is happening initially, if one tested COVID positive, then, the proceed was to deal as a COVID, for the process, for the everything. But of course, if they have something else, they will include it in the death, paperwork that needed to go. He tested positive, but also he had a heart attack. He died of both things, unless, they only had one thing, just COVID, and that's what they do, just COVID. So, yeah.
Thank you.
I'd like to ask a question. And
Sure.
in your travels around, are most people wearing masks, or is there some resistance to that and social distancing? Is it?
Oh, good question. This is a question that everybody should ask, if should we use mask or not, and what's the consensus. So Brazil, it's a big country like US, and there is a lot of people that don't read or write, especially in the countryside of Brazil. So some people believe that they don't need to wear mask for one reason or another, depends on who you ask for. And some people do believe that it's a good thing. So mostly if you are, let's say, in the beach settings, they think that they don't need it because the sun is like 7 degrees, everything is so hot. So they tell you like the COVID is not there. So it also depends, as I said, if you are against the president or pro the president. So it's not like a science thing, just like a political thing. And there is like this other type of people that they do, want to wear the mask to help others not to get the virus, if in case, or they think that makes sense to wear the mask. So we have all these ranges of people. It depends on where you are or who you talk to. um, I think that it's not like a law like in here. I feel like that in Brookline, it's a law. You have to, even if you're walking on the streets. In Brazil, it's more like if you go into a restaurant or if you go into a public space or if you go into a store. So there is a sign that say you have to wear a mask to come in. But if you are at the beach, there's no way that anyone can control you to wear the mask because there's so many people already at the beach at this point. It's summer all year long in Recife. So for the whole year, people can go to the beach because it's warm. And they think that if they are like swimming in this water and they got the sun, they are not going to get COVID. So it's another belief. Does that make sense?
Yes.
Did I answer your question?
Yes, you did.
Okay,
I have a,
good.
Dayse.
Susan has a question.
Well,
Yes.
Dayse, when we were talking earlier, you had mentioned to me stories about how difficult it was for you to get access to treatment materials for your patients.
Oh yeah,
You want to?
that could be a book, Susan. That could be a book. The hospitals, they have protocols. I don't know how it is in here exactly, but my friend said that they also had some difficulty here, especially in New York, where everything kind of took a different stage initially. So we did have some very cheap antivirus that initially, everybody thought that that would help in some ways, antibiotics and other medications that could help. So, but the hospital settings, you can only do it if if the hospital allowed you to do, because there is no treatment for COVID right now. But I myself personally, I try to help the patient as much as I could. So if a patient, I think, is having fever and they need some special treatment that I do for myself and my family, I would definitely try to provide the patient as well. But from hospital policy, sometimes it's not possible. So they had to sign an agreement said that this was a research kind of treatment. It's not like set in stone as treatment for COVID or nothing like that. And now, if the patients need something that I could help with, that now is called the early treatment for COVID. Um, so then it's going to be, for early stage people that don't need to go into ventilators, they just have fever, my symptoms. So now they call early treatment for COVID if they test positive. So that was one of the big issues at the hospital. The other one was about the equipment, because the hospital felt that we had the right equipment of protection for the triage. That's where I was, at least, and we felt that we needed a little bit more protection, because if you imagine that the triage, everybody comes from everywhere. So it's not that we should not be protected as much as people they are in the ICU. It should be. I mean, it was my point of view, and a lot of my colleagues that were there. They should be wearing goggles and N95 and things like that. But the hospital didn't have enough to provide for triage. So we kind of, initially we start buying ourselves our equipment. So I have this photo of all of us. Everybody has a different mask. It was like everybody have your different clothes. It was like you try to do your best thing. But that's how it is at the triage. But at the ICU, they try to have a better equipment and provide more goggles and N95 to physicians and health workers that are on the treating patients there. If we look at the data, that I didn't want to get into that because it's very like research related. You look at the data, you see that a lot of physicians got infected, and that should not be allowed. Actually, I think that should be avoided, because these are the people specialized that needed to be there to treat people, and a lot of physicians died in these um, things, because there was not really a protection as should be. And that's a sad story. I don't want to cry right now because a lot of my friends died. I had from my school at least 3 or 4. So it was not funny. I really thought that they should have taken care of us more.
Yes,
Yeah.
they should have. Dayse, do you know how active Rotary has been in Brazil in terms of trying to combat this situation? Any ideas?
Yeah. There is a lot of that they're trying to help with, but Brazil is such a big country, and as I said, it's low income people are more like 80% of them. So I don't think there's enough that the Rotary can do in Brazil. Hopefully next year when the vaccine comes, and then we have more to do and we can help more people. at the same time. But right now, we're just doing like, distance and try to teach the people about it, what it is and what they should be doing as much as we can for the ones that are interested in learning. But some people just don't believe. They say, that you could talk to someone and they say, oh, they just make up this disease. They don't exist. It's just like I said, okay. Yeah, okay, that's what you think. Yes, I think they just make up their thing so they can win the political parties or things like that. It's funny. I don't know if that happens here. And yeah, but it's an interest perception of the COVID-19.
Is
But
there something that we can do to help you and your colleagues, Daisy?
oh, Susan, you're so kind. I'm very grateful. And I'm happy to, we have done before this do grant that we could do with Brazil and also for people here too, because I know also they need it here in some ways. We could definitely write up a grant and I can provide more information on the specific, maybe mask and maybe more protection. Also, I don't know if it's possible yet, but I also can talk to Brenna to see, as this small company that she worked for, if she would provide more testing in Brazil. That would be very nice if that could be done. But I thank you for asking. We can definitely talk about it offline later to see how we could work together, because I know a lot of my friends that do work with Rotary as well. Thank you. I appreciate that.
So Dayse, for the
Yeah.
80% of people who do not have private insurance,
Yeah.
is there a way for them to get treatment and testing? And if so, who pays for it?
So that's called the universal health insurance that we have in Brazil. So the government pay for it. So that's why now they're building this campaign hospitals at the soccer stadiums and at the parking lot of shopping malls. So there is a lot of that initiative to try to get them more of the ventilators and things like that. But that's how it's done. It's not enough, but it's something that they didn't have it before access, because the ventilators are expensive, and a lot of these people, they don't have access to that information that they need, to do early treatment, or they need to be at a home, or sometimes being at home means that they are going to be with 10, 20 people in a house. So it varies. So to make sure that I answer your question, yes, Brazil has this, that health insurance that's for all and it's free from the government, but doesn't, it's able to get.
Yeah. Now, when we were in Brazil, we were with you in Recife.
Yes.
We were in Rio. What is the situation in the favelas there?
Oh, it's like any favela feel, basically, it's the same situation as, as it is, in one bedroom, you have like 5, 10 people. So you can imagine, there's no really way for them to manage this disease. And sometimes there's not even water to wash their hands, around. So they have to walk some far away to get so anyway, it's very difficult for them too. So that's why we try to build these places that they can come in, not only the big hospital, but also this, campaign hospital, build it outside, the soccer fields and things like that. But yeah. I think I feel, if you're interested in actually seeing the favela inside the slum, you can go to YouTube and they have recorder you know, how it is inside of the favela, not only in Rio, but also in Recife, in other states, São Paulo. Also, they have very big slums as well. So it's very easy to see like a photo, and we can now they record everything. Yeah, but that's a good point. There is no solution for that yet. And you know, now there is a lot of little kids that get infected, and there's this new you know, wave of kids getting infected. How is it here? Do you get a lot of kids infected with COVID? I don't know. You do?
Yes.
Yeah.
And of
Is it-
course, they can transmit it to the older people.
Sure. Yeah.
Well, and they're also finding children, some of them are getting Kawasaki disease,
Yeah.
yes.
who are more immune compromised. So I don't know if you've seen that in Brazil, but that's become a serious
Oh,
issue for
yes.
immunocompromised kids if they get it there. That
Yes.
really makes it. I do have a question. Are the hospitals have access to remdesivir to treat people in the ICU?
Oh, not in Brazil. It's not approved there. And actually, it's even here. It's for clinical study, right? I'm not
No,
sure.
they're
if
using
they
them
are-
in hospitals.
They're
They're
using
using it in
already.
hospitals.
Oh,
Mhm.
that's awesome. Oh, that's amazing. That's good. Good. No, we don't have that in Brazil. It's not approved there yet.
What
Daisy?
happened, Daisy, was the president got COVID, and he was treated with remdesivir, and he was convinced that I think that it helped him. So
He
he
said
ran
cure.
it through the FDA.
Yeah.
He
And
got one
now
coming.
it's an approved treatment. So
Oh, they just approved?
One
Oh,
week
yeah,
ago.
approved,
You got
Oh,
approved
okay.
got approved 1 week
after
ago.
he-
Wonderful.
2
That's, I
weeks
thought
after
that
he
was
got it, they approved it. Yeah.
Daisy?
Barney, you've been trying to raise your hand.
Yeah, Daisy, two things.
Yes.
During the election of your president in Brazil, does the existing president, what does he feel about COVID? And what does his opponent think about COVID? And the second question is, in Portuguese or Spanish, how do they pronounce COVID?
That's an interesting question. You know, the funny thing about it, that's the first time ever that the Brazilian president actually, it's a very good friend of Trump. So they're kind of working together, and they have similar point of views in some ways about the COVID. And I don't know if that's a good thing or not, but it's more political decision. I just don't get involved with that. And the second question you said I'm sorry, can you repeat the second question?
Yeah,
for me?
how do they pronounce COVID in Portuguese or Spanish?
Well, it's the same thing. In Brazil, it's the only country in South America that speaks Portuguese. So in Brazil, it's COVID, like you do here too, like COVID. But instead of COVID, it's just COVID.
Thank you.
Like the VN, it's the last name is VIN that you pronounce like higher. And here's the opposite, it's like Colvin, and then there's Colvin. So you can't get wrong. Either way. Yeah.
So are the schools closed? You know, in Boston, the city of Boston, the schools were opened.
Yes.
And
So-
last week, the rate of infection got so high that they are closing the schools in Boston. What happened in your area? Are the schools open or not?
That's a great question, Phil. You know, I told you they're very good. The two presidents, they work together. So they did the same thing in Brazil. They open up, then there was like this high rate of infection, you know, and the kids were getting more COVID and had this inflammation. And then they some of the school, they closed again. Not all of them, but some of them they closed. So yeah, it happened the same way. And unfortunately, we didn't do a good job in that sense. I don't know when they're going to reopen, but we are working on that too to see, how we could do that. I think the presidents, they seem to think very similar about these things. Yeah, they open up and then they saw all this trend of students get infected, and then they close some of them too.
Well, you mentioned that there's an election in Brazil. Has it happened yet?
No, it's November 15. So I came to vote here. So you see here, please vote. I knew Susan would like that. Please vote. And yeah, it's November 15. I'll be there for the voting too.
And does his opponent have a different point of view about masks and so on?
Yeah. So everybody think differently. So they kind of strategically stay in different groups. So some think that everybody should wear masks. Some think that they should not wear masks. But most of the educated people, they do wear goggles and masks, and they respect each other. But if you go to the beach, most of the people are not wearing masks. So that's funny thing too. I don't know, do people wear masks here at the beach? I was just wondering. I know it's cold, but
It was mixed when people were going to the beach. Some were, some weren't.
I see.
It depends
And
on
it
the
depends on what state you were in too, that you were going to the beach.
Well,
Yeah,
we were in Florida until July.
yeah.
And one of the reasons we came here was to get away from Florida, where the governor
I
is
hear
of
you.
the same political party as our president and wants the economy to open up as soon as possible, schools to open up, and even bars where people are sitting next to each other with no masks, drinking, talking loud, and spreading their germs.
Yes, I hear
So
you.
in Florida, people were not wearing masks at the beach, and there was only one town that closed the beach.
I see. So
And-
did you ask why we're not wearing it at some point? I'm thinking that might be the weather. They might say, okay, this is warm weather.
The president
was
said
it-
it's only like a flu and like a miracle, it will just disappear. And they minimized the danger.
Okay.
They accentuate the danger, and it is a danger of people not being able to work and not having an
Yes.
income, which also is serious.
Exactly.
So
I
how do you
agree.
balance the economy versus public health?
I agree. I mean, my younger brother lives in Florida, and he's over 60 years old, and then he just stay home. He's working from home. So, yeah, but his wife, she's a nurse at the hospital, so she goes twice a week to the hospital, and yeah. So he told me that a lot of people don't wear masks, so he doesn't feel very comfortable there. I think it was a good idea to come back here. Are you thinking about going to Florida at some point?
At some point, but we're waiting for people we know there to tell us it's safe.
Okay.
Don, you have a question?
Yeah, I had a question, Daisy, about the economic situation in Brazil. I know that's been difficult there for a while, but here with the sudden downturn of the economy, the government and most of the politicians have decided that they should pump money into the economy and give people money to spend to try to build the economy.
Yes.
And I was curious if they're trying similar programs where your president is aligned with Mr. Trump.
The same thing. Isn't that amazing? So It's not a lot of money, just like $100, per month. But it's, if every single member of the family has $100 per month, in a family of 5, then they have enough to eat at least, so the criminal case don't go up. So that has been very big help. I hear from my housekeeper that she tells me that's very helpful for some people that really need it. So I think in some ways it does help people. In other ways, it's more difficult for them to build up a company or, to accept a job offer or things like that in other ways. So my housekeeper, for one example that I had at home, her son had a job offer, and then she was asking me if he should accept the job offer because, he was having this free money from the government, and then he could have, like this, not like a regular job of, the market, things like that. So it's very like, some people want to have the money, some people wanted to work full time and get a regular job. So I think it does help a lot of people in
It's the
some
same,
ways.
it's exactly
Yeah.
the same here. Can people be thrown out of their apartments or homes if they can't pay their?
So
rent?
that's a little different in Brazil. So I feel like my young brother, the one that's an engineer, he has this home where he rents. So I feel that in here, it's very more, it's like flexible. The owners can ask the people they're renting to go out if they don't pay, the rent. And in Brazil, you can't do that, so the owner don't receive money at all. But no, the privilege is to the people that rent and they can't pay. So right now, the people that have the building or the apartment, they're not making money right now. Yeah. Did I answer your question? That's a little different, but yeah, they protect more the people they are renting instead of the owners. So how it is in here? Would you know how do they protect the owner or the renter? I don't know for
Yeah.
I
sure.
think it also varies from state to state, but Massachusetts, from my experience with housing, there are stronger protections for renters than for owners, but still the owners have a lot of leeway to evict.
I see. Yeah,
Uh,
makes sense.
Right now, there is, Massachusetts had a moratorium on evictions to October 15th. Right
Mm-hmm.
now, there is a federal moratorium in effect. When that ends, the people who keep track of this thing say that about 40% of the people who rent in Massachusetts are at least 1 month behind in their rent, which means that
How
there's
many?
a staggering number of evictions coming up, probably in December or January if nothing is done.
I heard 70,000, Steve. Did you say 40%?
40% of renters.
I think that's way too high.
You say 70,000, which is
That was the last number I heard. It's probably a little low, but it's 40% would be well over 1 million.
yeah. All right, so
But it's a lot. It's a lot of people.
maybe the person
It
who
is.
gave me my number was trying to.
Howard, we haven't heard from you.
Greetings. So we are actually back from the Cape on Tuesday. We do plan to be here depending on what happens in Brookline for the winter. However, if things do get hot, it's back to the Cape. For the most part, people out walking, we're wearing masks. I'm normally not one of them. The problem is I don't want to put a hole in the mask to stick my cigar through, but smoking a cigar, people stay away.
Good.
And on the beach, people weren't necessarily wearing masks sitting, but it wasn't that crowded where we were on the Cape that, there was enough social distancing. And as far as Florida goes, something I happened to see on CNN today was the reason that the governor in Florida did what he did was because the president's new expert came down and personally told him what to do and what to say, and he just went hook, line, and sinker. So this idiot Atlas is screwed up the state of Florida.
Wow. God.
Sharon, one last question, I guess. Sharon?
Dayse, thank you so much. I'm wondering, are there any countries that Brazil is actually working with around the economy or the COVID, or that are trying to get in and to help out some?
You mean on the medical side, like research side, or on the economy side?
Either.
Oh, on the medical field, we work with trying to understand the disease better in many countries. I have a series of friends, from the American Academy of Ophthalmology, that we try to understand better the disease because we're just learning about it. And on the economy side, I don't know if Brazil is working with other countries, but I know that the health organization is working with Brazil as well, like for the vaccines. There is a deposit of vaccines in the OMS. And Brazil is there to try to have as much as patient tested in Brazil as well. So we are very active in trying to test people in the vaccines to see which one's going to be working better for us together. Yeah.
Well, I'd like to thank you, Dayse. It
Well,
was a wonderful presentation. I did not realize that in the situation of COVID, Brazil and the United States might just as well be the same place, have the same problems, and we're going about it the same way. And for what
Can
that-
I say I am eternally grateful that your daughters have decided to stay in the Boston area, at least for now, because then we are assured of seeing you now and then.
well,
Thank you, Bianca and
Susan.
Brenna. And
Thank you.
Dayse, you know that our prayers and our good wishes are with you down there in
Me
Brazil.
too.
You are
I second
always
that.
welcome
All of you.
here, always. It's good to see everybody's faces. Stay well, everyone.
Okay.
Yeah, you too.
Bye.
Thanks,
Thank you.
Dayse.
Bye.
So much.
Nice to see
Keep
everyone.
looking at the grass from the green side.